This is your Daily Mix. The following segment is sponsored by.
Welcome back, everybody, to your Daily Mix. I'm your host, Melissa Carlson. Joining us today, we have got Dr. Ali Narizi. He's the owner of the RenoTahoePain Associates and United Pain Urgent Care. Dr. Narizi, thank you so much for being with us.
Hi, Melissa. Thanks for having me back in Daily Mix.
Absolutely. Well, talk to me a little bit. If anybody's not familiar with your locations, what is it exactly that you're doing there?
So, Melissa, we, for the first time actually in the nation, will design a place for acute injuries, for painful acute injuries. And also we have our chronic side, RenoTahoe Pain Associates. So we have combination of both places for patients who suffer from acute injuries. Painful can be from migraine attack to back pain, or injuries, fractures, to people who suffer from chronic pain. So if they have spine issues, they have joint problems. So we have different different locations for them to go for different pathologists to address their needs.
Yeah, you're doing stuff that people around the country aren't even doing yet. We're doing it here in Reno. You are. Check out their website. Incredible stuff going on there. But let's talk about one of the main problems we hear for a lot of people. It's one pain that can affect all over your body. We're talking about spine pain. You've got a couple different ways of dealing with it. One of them is called, this one's interesting, kyphoplasty. What is that?
So that's a very good question. There are a lot of issues can happen with the spine, and each pathology has a different treatment. So we have to identify the right patient with the right treatment at the right time. That's the philosophy behind providing the best care. So the kyphoplasty is for the patient who suffers from a fracture of the spine, part of the vertebral body is spine. For example, they walk, they fall down, and all of a sudden they have extreme back pain or a thoracic pain. So when they go to our urgent United Pain Urgent Care, for example, we do the imaging, X-ray, fracture, then we can treat these patients with putting a cement into the part of the fracture and fix the fracture. So then we expect the pain to go down significantly after. So this is a very easy treatment for the patients, and we do these treatments in office, so they don't have to undergo extensive anesthesia or surgeries for that. It's very simple and it's done in office.
Pretty incredible. Also dealing with people who are dealing with cancer. That can be, the spine rather can be a massive problem when it comes to dealing with pain.
That's correct, because the fracture also can happen because of metastasis. So some people who have tumors in their bone of their spine, they can have either significant pain associated with it, or they can have fractures. So one of the treatments that we do with tumor ablation. So we go inside the vertebral body and we burn the lesion and tumor, and then we fill the cavity with the cement to basically get rid of the pain associated with the tumor and also burn the tumor. Has been very helpful for our cancer patients to treat them. And this is another one that simply can happen in office. So you don't have to undergo an anesthesia for it.
That is incredible when you think about what you're doing, and it can be done in the office. Something else, the zip procedure.
Yes, so these are the new technologies that every time we come across. So we go ahead, we treat the patients who used to have extensive surgeries. For example, instead of having something that what we offer right now, they could have had a lot of like a multiple level of fusion, screws, rods. But now with the spacer we place in their back, which has a bone graft, we can address the people who suffer from back and leg pain. And it's very simple outpatient procedure, and then they go home on the same day. So the result has been very successful for us. And this is one of the treatments that now we can offer in a very minimally invasive fashion to our community.
Something else, also got a seminar coming up where people can learn more about all of this. Talk to me about that.
Absolutely. So this is one of our commitments, to educate our people in communities, to let them know what their options are. That's always good. It's coming up on the 26th of October, and we have a live webinar and also in person. So we bring some of the patients who have had these treatments to give their own story of their lives and how they underwent this treatment. So if your viewers are interested, they can go to our website at RenoTahoePain Associate and sign up for the webinar to attend.
Dr. Ali Narizi, thank you so much for what you do in our community and for being with us today.
Thanks for having me.
This segment was sponsored by